Welcome, you curious explorer, to another deep dive. Today, we're plunging into the world of lymphadenitis.
Yeah, lymphadenitis. So basically, we're talking about inflamed lymph nodes.
Exactly. And just so you know, our sources today are mainly looking at this from a veterinary angle. In animals.
That's right.
Now, I know what you might be thinking, swollen lymph nodes in pets, why should I care? But stick with us.
Yeah, our mission here is to really unpack the what, the how, and maybe most importantly, the why behind it.
You might actually be quite surprised by what this tells us about the body's defense systems, how they work.
It's pretty intricate stuff.
Okay, so let's get into it. What is lymphadenitis really? What's happening in that lymph node?
So at its core, lymphadenitis means inflammation in one or maybe multiple lymph nodes.
Yeah.
And it's not just like swelling.
Not just bigger.
No, it's an active process. You have immune cells, neutrophils, macrophages, sometimes eosinophils actually moving into the node. They're migrating in there to fight something off.
Ah, okay. So it's different from something like lymphoid hyperplasia.
Exactly. Hyperplasia is more like bulking up the garrison, increasing the number of immune cells present, but maybe without an active battle raging right then. Lymphadenitis is the battle itself.
Gotcha. The troops are actively engaged. So what usually kicks off this battle?
Well, the most common trigger is an infectious agent, bacteria, a virus, fungus, maybe a parasite. Something gets into the lymph node.
How do they get in there?
Lymph nodes are basically filters, right? They're constantly sampling the fluid moving through the body's lymphatic system. So they inevitably encounter these invaders.
Little security checkpoints, constantly swabbing the decks.
That's a good way to put it.
Yeah.
Now, infection is the main thing, but there are other less common non-infectious causes too.
Like what?
Eosinophilic lymphadenitis is one example. That's where you get a buildup of eosinophils, often linked to a bigger inflammatory issue happening elsewhere.
So a problem in the node might just be a sign of something body-wide.
Precisely.
Which body systems are we really talking about here?
Primarily the hemic system, so
Yeah.
blood components, the lymphatic system itself, obviously, and the overall immune system.
Right.
But because it's often tied to an infection that started somewhere else, it can really touch on almost any organ system indirectly.
Okay. What about genetics? Are some animals just, built to get this more often?
Generally, lymphadenitis itself doesn't have a strong genetic link across the board. It's more about susceptibility to the underlying problem.
Ah, I see.
So, for instance, basset hounds are known to be more prone to certain mycobacterial infections, and lymphadenitis is often a sign when they get those infections.
Okay.
Or Rottweilers. They seem predisposed to something called idiopathic hypereosinophilic syndromes, and that can show up as eosinophilic lymphadenitis. So the genetics influence the disease causing the lymph node issue.
Makes sense. It's a common sign, you said. How common are we talking? And does it pop up more in certain places?
It is a frequent finding with many infectious diseases, so yeah, common in that sense.
Yeah.
But getting exact numbers like incidence rates for just lymphadenitis, that's tough. It gets logged under the main disease.
Oh, right. It's a symptom.
Exactly. Geographically, though, you do see patterns. Its occurrence often mirrors where certain systemic fungal infections are common.
Oh, interesting. Like,
Histoplasmosis in the central U.S. or blastomycosis more in central and eastern areas. Lymphadenitis is pretty common with both of those.
okay.
And leishmaniasis, though rarer overall, you find it more in the southern and southwestern U.S., and it can cause significant lymph node inflammation too.
And who gets it most? Dogs, cats.
Yeah, dogs and cats are the main species we see it in. And very young animals, neonates, might be a bit more susceptible,
Why is that?
just because their immune systems are still developing, really. Makes them more vulnerable to infections in general.
Right. Okay. So we've got the basics down. Now, what would someone actually see? What are the signs if an animal has this?
Well, often the first things an owner notices are actually related to where the infection started, not necessarily the lymph node itself.
Ah, okay. So maybe coughing if it started in the lungs or something like that.
Exactly. But if the lymphadenitis is part of a more systemic, body-wide infection, then you might see those general signs of illness.
Like fever.
Yeah, fever. Maybe the animal is just lethargic, not feeling well, malaise, we call it, and maybe not eating, anorexia.
So the swollen node itself might not be the obvious thing.
Often, no. Owners usually don't notice lymph node enlargement unless it's really, really significant. It typically takes a vet doing a physical exam to pick it up.
And what would the vet feel?
The inflamed nodes usually feel larger than normal, obviously. They're often quite firm, and they can be painful when the vet palpates them, when they press on them.
Painful. Okay. That's a clue.
Definitely suggest active inflammation. And sometimes, especially with bacterial infections, the node can actually form an abscess.
Like a pocket of pus.
Exactly. And that abscess might even rupture and start draining fluid to the outside. That's something an owner might notice, like an open sore that's weaving.
Yikes.
Yeah.
Okay. And fever, you mentioned, and other general signs too?
Yes, signs pointing to a wider infection could definitely be there.
All right. So let's talk culprits. Who are the usual suspects causing this inflammation?
We can lump them into big categories. You've got infectious causes, bacteria, fungi, viruses, protozoa, even algae, and then the less common non-infectious ones.
Okay, let's start with bacteria. Which ones are common players?
Well, lots of different bacteria can cause it, incidentally, but some pop up more often.
Right.
Think species like Pasteurella, Bacteroides, Fusobacterium.
Okay.
But then you have some bacteria that seem to really have a thing for lymph nodes.
Like they target them specifically?
Almost, yeah. Yersinia pestis, that's the plague bacterium, and Francisella tularensis, which causes tularemia. They're known for hitting lymph nodes hard, especially in cats.
Wow, okay. Plague and tularemia, serious stuff.
Definitely. We also see Bartonella vinsoni causing a specific type, Granulomatous lymphadenitis, in dogs. And other Bartonella species in cats might cause hyperplasia, but they can be tricky to spot with standard tests.
Interesting. What about fungi?
With fungi, lymphadenitis is usually just one part of a bigger systemic illness that's spread through the body.
Ah, right, like the ones you mentioned before.
Exactly. Blastomyces, Cryptococcus, Histoplasma, Coccidioids, Sporothrix, those are the common ones. But really, lots of other fungi could potentially cause it too.
And viruses, do they cause this kind of inflammation too?
Viruses often cause that lymphoid hyperplasia we talked about, more cells bulking up. But yes, some viruses are definitely linked to actual lymphadenitis.
Any specific examples?
The key one is coronavirus, specifically the type that causes feline infectious peritonitis, or FIP.
Ah, FIP. I've heard of that.
Yeah. In FIP cases, the mesenteric lymph nodes, the ones in the abdomen, are very commonly inflamed.
Okay. And the others you mentioned, protozoa, algae.
Yeah, they're less common overall, but definitely can be involved. Protozoa like Toxoplasma and Leishmania often cause lymph node inflammation, even if it's not the main sign you see.
Right.
And there's an algae, Prototheca, that can cause a generalized infection in dogs called protothicosis, and lymphadenitis is part of that picture.
Algae. Wow, okay.
And just briefly touching back on non-infectious causes, often the exact trigger isn't known, but they can be linked to those eosinophilic diseases we mentioned, maybe affecting the lungs or other organs.
That is quite the rogues gallery of potential causes. So are certain animals just more likely to get lymphadenitis? Risk factors?
The biggest risk factor really is anything that weakens the immune system.
Makes sense. Defenses are down.
Exactly. If the body's defenses aren't working properly, the animal is just more susceptible to all sorts of infections, which then makes lymphadenitis more likely.
What kind of things weaken the immune system in pets?
Well, in vet medicine, some common culprits are viruses like feline leukemia virus,
Yeah.
FeLV, and feline immunodeficiency virus, FIV, in cats.
Okay. FeLV and FIV. Got it.
Those are major ones that compromise immunity.
So, logically, if the defenses are weak, infections take hold, lymph nodes react. Okay. So how does a vet figure this all out? When they suspect lymphadenitis, what's the diagnostic journey like?
Well, first step is often differential diagnosis. You feel a lymph, is it really a lymph node?
Could it be something else?
Absolutely. Could be a tumor, could be an inflamed salivary gland that's cytologitis or some other tissue reaction. So rule one is confirm it is a lymph node.
Okay.
Then even if it is a lymph node, just feeling it usually isn't enough to say for sure it's lymphadenitis versus, say, hyperplasia or lymphoma cancer of the lymph node or cancer that spread there, metastatic neoplasia.
So a swollen node could mean several different things.
Exactly. The physical exam gives clues, though.
Like the pain you mentioned.
Right. If the node is painful and maybe the animal has a fever, that strongly points towards active inflammation, towards lymphadenitis.
But not definitive.
Not definitive. And it's worth remembering, actually, that lymphoma and simple hyperplasia are more common causes of generalized body-wide lymph node enlargement than lymphadenitis is.
Okay, that's important context. So physical exam gives clues. What about lab work? Blood tests?
Blood tests are really helpful. A CBC, complete blood count biochemistry profile, urinalysis, they give us pieces of the puzzle.
What might you see in the blood?
You might see what's called an inflammatory leukogram. That's a pattern in the white blood cell count suggesting infection or inflammation. Maybe high neutrophils suggesting bacteria.
I see. So it's not always there.
Correct. Its absence doesn't rule out lymphadenitis.
Yeah.
But if it is there, it's supportive.
Okay. Anything else in the blood work?
Yeah, sometimes with systemic infections like certain fungal diseases or leishmaniasis, you might see high levels of globulins. Those are proteins. And with severe eosinophilic conditions, you'd expect to see lots of eosinophils in the blood count.
And the biochemistry.
That can give clues about whether other organs are being affected by whatever the underlying process is.
Got it. Are there more specific tests to nail down the cause? Like for fungi or Bartonella?
Yes, there are serologic tests. They look for antibodies in the blood against specific bugs. They can be useful for some fungal diseases, sometimes Bartonella.
Sounds like there's a but.
Well, they're often most useful when we haven't been able to find the actual organism directly using other methods. Direct identification is usually preferred as possible.
Okay. What about looking inside? Imaging, X-rays, ultrasound?
Oh, absolutely vital.
Mm.
Especially for the lymph nodes. We can't feel the ones deep inside the chest or abdomen.
Right.
Radiographs and ultrasound help us see if those internal nodes are enlarged. And also check other organs. Like if we suspect a fungal lung infection, we'll look for changes on the chest X-rays. Very important.
So putting lots of pieces together, what about actually sampling the node itself?
That's often the key step. Fine needle aspiration, or FNA.
What is that?
It's pretty straightforward. Use a very thin needle, insert it into the node, pull back a small sample of cells, put them on a slide, stain them, and look under the microscope.
Sounds minimally invasive.
It is. Usually done right there in the clinic. We typically use a simple stain like a Romanowski type, maybe Diff Quick. And if we suspect bacteria, we might do a Gram stain too.
And what tells you it's lymphadenitis under the microscope?
You'll see lots of inflammatory cells that shouldn't normally be there in high numbers. Neutrophils, macrophages, eosinophils, maybe a mix, different from a healthy node, or even just hyperplasia.
And can you see the actual cause, the bacteria or fungi?
Very often, yes. That's the beauty of cytology. You can frequently spot the bacteria, the fungal yeasts, maybe protozoa, even algae right there in the sample.
Wow.
Honestly, cytology is often the quickest, most direct way to identify the infectious agent, whether it's just one node affected or a whole body thing.
So often FNA gives you the answer, what if it doesn't? If it's inconclusive?
Then the next step might be a lymph node biopsy.
So actually taking a piece of the tissue.
Exactly. A small piece is surgically removed. This gives you more tissue architecture to look at, that's histopathology, and you can also send part of it for culture to try and grow the organism.
More information, but more invasive.
Right. Cytology first, biopsy if needed.
And what does the actual tissue look like in lymphadenitis on the biopsy?
Grossly, when you look at the node itself, it's usually enlarged, firm, maybe distorted in shape. Sometimes the inflammation breaks through the capsule into the surrounding tissue.
Oh, eh?
If you cut it open, it often looks redder, more blood-filled, hyperemic. The internal structure might look messy, nodular, and in severe pus-forming cases, you might see actual abscesses inside.
And microscopically, what are the hallmarks of the different types?
Well, for purulent lymphadenitis, you see tons of neutrophils infiltrating, messing up the normal structure.
Okay.
Granulomatous type, that's characterized by collections of macrophages. Eosinophilic, loads of eosinophils, just as the name suggests.
Makes sense.
And one thing you often see across all types is necrosis cell death. That's pretty common when there's significant inflammation.
Okay, so a very detailed picture from biopsy. Now, once you have the diagnosis, maybe even know the cause,
Yeah.
what's the treatment? How do you fix it?
Well, the crucial thing to remember is that lymphadenitis isn't the disease itself, it's a sign.
Right, a symptom of something else?
Exactly. So treatment isn't about the lymph node swelling per se, it's about tackling the underlying cause and the specific type of inflammation happening.
Treat the root cause, not just the symptom.
Precisely. So, for example, if you have, say, just one lymph node that's clearly got purulent inflammation, looks bacterial, maybe you didn't see specific bugs on the FNA,
Yeah.
you might start with broad-spectrum systemic antibiotics while maybe waiting for culture results if you took them.
Kind of covering the likely bases initially.
Right. But ultimately, the most effective treatment, the best drug choice, really depends on knowing exactly what organism you're fighting. That's why the diagnostics are so important.
So successful treatment really hinges on getting that specific diagnosis first.
Absolutely. You need to know your enemy.
Well, this has been incredibly illuminating, a real deep dive into veterinary lymphadenitis. So to kind of wrap up.
Yeah, the key takeaway is that inflamed lymph nodes, lymphadenitis, it's the flag, right?
Yeah.
A sign something else is going on, usually an infection.
And figuring out what that something is requires some detective work, clinical exam, lab tests, maybe imaging, definitely sampling the node itself.
And the range of possible causes is just huge.
Yeah.
Common bacteria, various fungi, protozoa, algae. It really covers a lot of ground.
It really does, which underscores why getting that specific veterinary diagnosis is so critical for choosing the right treatment.
Definitely.
It leaves me thinking, considering how these lymph nodes are constantly working, acting as these little immune surveillance hubs, it makes you wonder what other symptoms that seem really localized, really specific to one spot, might actually be reflecting much bigger interconnected things happening throughout the body.
That's a fantastic point. It really drives home how interconnected everything is inside a living creature, doesn't it? Nothing really happens in isolation.
Really makes you think about the body as a whole system.